have to be with me. Good afternoon to everyone. I'm delighted to be joined by Jay Hill, DHS Director of Aging, Adult, and Behavioral Health Services, and then also joined by Trish Gann, Assistant Director of the same agency. And I'm very proud of DHS on a number of things that they're doing in terms of behavioral health, in terms of drug addiction counseling and services. And I want to be able to draw attention to that today and make an announcement at the same time. As everyone knows in this room, that we have a challenge across the nation in terms of drug addiction, as well as adequate providing of mental health services that are so needed across our country. And Arkansas is no exception to those challenges that we face. When I was in the DEA, we emphasized three pillars of successful anti-drug programs. First of all was enforcement, secondly education, and thirdly was the treatment side. And you always tried to balance those, but I soon discovered that we never had adequate treatment services, both in terms of length as well as in terms of coverage for those that needed those services. And in 2017, though, we started making progress through our transformation efforts of Medicaid to have more providers that are able to provide these services across the state. So in 2017, we transformed the Arkansas Medicaid program with the goal of expanding drug addiction counseling and mental health services. These changes included, first of all, ending the moratorium on providers that existed, and that moratorium ended on June 30th of 2017, and then making it a priority to provide certification for these providers in the underserved areas of our state. Secondly, we fixed the reimbursement rate to encourage expansion of counseling services across Arkansas. And this equalized the reimbursement rates for individual physicians and providers versus the large clinics and services that they provided, the larger agencies. Thirdly, we allowed co-location of providers and primary care physicians, a simple change that made a huge difference because this encouraged immediate access. If a physician identified an addiction problem or a mental health issue, they could have the same provider of those counseling services in the same offices and refer them down the hall for immediate assistance. And then fourthly, we decreased the provider administrative burden, and then we provided independent assessments to determine the need for higher level of services when there were the need for mental health services, counseling, or drug addiction counseling. I was very pleased with the result of these changes. DHS has added 176 new mental health and substance abuse providers across the state of Arkansas. There were 31 providers in 2017, and today there are 207 providers of mental health and drug addiction counseling across the state of Arkansas. In addition, there are 58 new behavioral health sites that are available across the state. In other words, access to substance abuse counseling has increased over 500% in Arkansas since 2017. The following areas of service are available across the state: substance abuse assessment, mental health diagnosis, and then many different areas of counseling and services that can be provided. This is great news for those that are suffering and challenged in these areas in our state. And of course, prior to this time, Medicaid did not cover and reimburse recipients for drug abuse counseling or mental health counseling. Now it does, and that opens up a whole new avenue of resources that are available. And as a result of this expanded level of services statewide, DHS recognized the need for a centralized location for help and referrals. And I'm pleased to announce today that DHS has created a helpline that is available for citizens across the state so that they can be properly referred to local and community-based mental health providers and drug abuse counselors. When individuals call the line, DHS connects them with a local provider for assistance. And so this notice will be provided across the state. Mental health and addiction services in Arkansas that's available, the steps that can be taken with a toll-free number. Call the DHS Mental Health and Addiction Services support line, 1-844-763-0198. And so this will be made available. And let me just reiterate the excitement of this news today. First of all, a 500% increase in the access of our citizens to mental health providers and drug abuse counseling. Secondly, we have this helpline that will be available to the citizens across the state for proper referral to a local community health provider. I see Kirk Lane, our drug czar here in Arkansas, as we used to call him, our drug director. Thank you for the great job that you're doing. I think you'll second the notion that this will be of tremendous help to everyone in our state as we continue to fight the challenges of drug addiction and the challenge that we see in adequate mental health services. So with that, I recognize our legislators that are here as well. A number of members have joined us from the General Assembly, and thank you for your support. With that, I'll be happy to turn it over to any questions.
Governor, will this helpline connect people to providers, or will it just tell people where the providers are? How do you get in contact with them?
This will connect the individual who's calling. First of all, it will be a live voice that will answer the phone, and they'll immediately be able to connect them with the technicians, the expert counselors that exist within DHS. In addition, they'll be able to refer them to the local community health providers that are in their community they might not be aware of, and be able to tell them with Medicaid this counseling will be covered as well. So it will be immediate access to assistance. At the beginning, this will not be 24 hours. This will be 8:30 to 4:30, Monday through Friday, and there is available 24-hour assistance through community-based health clinics, and so that access is there, but this will be an additional tool in the event they're not aware of that immediate access and that 24-hour help. As we review this as a pilot, and if we deem that it'll be necessary to expand the hours, we'll certainly look at it, but that's where we'll start on this.
Will the funding and the resources come from the existing DHS budget?
It will. And let me invite Jay Hill to come and answer any more specifics on how that health line will work, but I appreciate his leadership on it. Jay?
Thank you, Governor. Questions?
Well, I sort of pinged you without a question.
I'm sorry.
You've got a question here.
Yes, ma'am.
Let me see. How much will it cost?
Our contract, Trish? It's not, our staff, of course, this is a DHS operation internally, so our staff are already there. There's not an additional cost for DHS staff that are fielding those calls, that are passing those along. We do have a contract through AFMC to take the initial calls, and I will get you that information for what the contract amount is.
When will it be operational?
Jay, it will be operational immediately.
It is. It's operational immediately. We're ready to go, and we're very excited to see the output and to be able to offer the access to Arkansans for the increased services that we've seen over the work for the last 2 years through transformation.
Yes.
Is this based on any programs in other states?
Other states, I'm sure, do have access to services lines similar to this. Ours is tailored to Arkansas's needs. As we saw the rapid increase in our providers through our independently licensed providers, through our behavioral health agencies, we recognized there was a great need to get that message out to Arkansans to let them know that we have worked diligently, we have improved their access to care, and we believe their quality of care. So this line follows that tremendous growth in our providers, and to be able to get that information out to our citizens that may otherwise not know that it's there.
Where can people find the number to call?
Well, this will be posted throughout Arkansas. We'll make it available in as many locations as we can. We hope that through the media today that this will be advertised, made available. We want the citizens to know that we want them to know two things. First of all, that they can, if they are in an addiction crisis or if they're in a mental health recognition that they need additional services, that they have this immediate access. Secondly, we want everyone to know that we've expanded so dramatically the local community-based providers. And this all fits together because not only is this helpful in our communities for the greater needs in terms of those that have addiction problems or mental health crisis, but it also helps us in terms of our transfer of more of our youth services from institutional care to our community-based care under the proper circumstances, and they need these kind of services available in their community, and that's a pledge that we have. And then our crisis stabilization unit fits into this as well, because if someone comes into a crisis stabilization unit referred by law enforcement, they can be stabilized for a period of time, I believe it's 48 hours, but then they need to be referred out for additional care. Well, it doesn't help us any if we don't have the providers that can provide those addiction counseling and mental health services. So all of this fits together in a universe that points us in the right direction in Arkansas in all of these areas to make sure these services are utilized and available in the local communities. Representative Gardner, are you excited about this? I am. This will help you in Northwest Arkansas, and thank you for being so supportive.
Governor, as the number of providers have come online, how much variety and diversity in terms of the programs they offer are there similar programs that are following successes or at least established ideas of counseling and treatment?
Well, that's a great question, and whenever you have 300 plus providers across Arkansas, everybody, they might have different protocols that they follow. They might have a different program that they believe is successful. And so, there's choices that are out there. And then secondly, while the services are broad that Medicaid will cover, there can be individual counseling, there can be group counseling that's available to them, or family counseling if it's needed. It can be a referral for additional medication if they need medication to govern and to control the mental health challenges that they have. It all depends upon the needs of the circumstances, and but there's broad-based services that will be covered by Medicaid under this initiative. All right, with that, they will be available for additional questions if you have it afterwards. Again, thank you for your attention to this. I've seen this build over the last year and a half, and we just needed to put an exclamation point on this success and this real transition and transformation in Arkansas on community-based mental health services that are so essential for our success and the direction we need to go. Thank you. Well done. Okay. Thank you, Governor.